completing and participating in the survey, both yourselves as employers and your employees, because without you, we wouldn't be able to host today and we wouldn't be able to demonstrate some of the trends and themes that hopefully you'll be able to take away into the following years with your organization. So thank you. Today is the culmination of several events across Asia around the Healthiest Workplace Survey. This is now moving to AIA's third year, driving this thought leadership. But it's off the back of 7 years of this survey existing in the UK. And we're using RAND as a global partner for academic research, partnering with universities across the region, as well as underpinned by Cambridge University in the United Kingdom. This very much underpins our approach to both thought leadership, but also leading in our markets around positive change. So where are we in terms of what the survey is and why we're doing it? This is all about awareness. In order to make change, unless we can create a shared understanding of why we need to change, very difficult to move that inertia. And as Stuart mentioned, in and around incentives, a number of different devices can be used in and around that, but it's about creating awareness and then moving up from awareness to engagement. All of you have organizations of varying sizes, employees of varying sizes. Unless you can then both create awareness around why your employees need to do things differently and have them engaged in different programs, very difficult to see any impact. At the same time, wanting to create an evidence base in each of our markets so that year on year, you're able to measure as an employer, and we as AIA at a market level can measure how people are changing their behavior for a positive impact for both themselves, their families, and colleagues. And fourth, and last but not least, is this thought leadership piece and the research that we will be then undertaking with some of our academic partners, so that not only is this using employers as a vehicle for positive change in every market, but having the credibility to be talking to both governments and regulators in and around the positive change that we expect to be going hand in hand going forwards. So this has been a huge momentum over the last 2 years for AIA in this space. We've moved from 10,000 employees in 2017 to over 24,000 in 2018. As Nick mentioned, 54 organizations here in Sri Lanka, over 2,000 employees participated in our first year, and really looking to see how this drives forward over time. Just to recap on how the survey is constructed and why it's constructed in the way that it is. It does have a very comprehensive organizational survey, which I know some of you would have taken the time out of your busy day to complete, alongside your employees providing their data. The two reasons why we have a compare and contrast is back to the awareness point. You as employers are investing in different schemes, different interventions, but you'll be amazed that whilst you're putting a lot of work in, unless your employees understand why you're doing it and where they can find that, you're spending a lot of time potentially not getting the impact that you need. So this compare and contrast survey approach is highly effective to test you in and around what you think you're doing and what your employees think they have available to them. So when you go through your company reports, you'll be able to dive into a lot of detail very specific to your company in and around what exists and what your employees think exists as a key takeaway, particularly around communication. So what and how we'll structure as we deep dive into the results. As I say, your employer report gives you a lot more detail, so I'll be really going quite quickly through some of the key trends that we saw through the survey, but based very much around your organization and productivity. And how you understand how health and well-being in the workplace impacts positively and negatively around productivity. And then understanding the long-term health consequences each of your employees and we ourselves face day to day with the choices we make around lifestyle decisions. And then I'll give an end around a few case studies around how we're bringing this into action both globally but also in markets across Asia. So what do we mean by productivity? it's actually quite important that we've all measured absenteeism for decades in the workplace, but very much this concept around presenteeism. Presenteeism talks about individuals turning up to the workplace, but not being effective in their day-to-day work. So if you're stressed, if you're unwell, if you're suffering from mental illness, you won't be as effective in the workplace as you would be if you were well-rested and in sound mind. And so it's very much around measuring that, such that then as you start to understand levels of presenteeism and start to bring interventions into the workplace to address that, you can see how that manages and improves over time. Where are we in terms of headline productivity? Actually, Sri Lanka performs very well. Only 17.7% of daily work in a given year is being impacted versus much higher levels across the region. And there are a few features in the context of Sri Lanka as we go through some of the results that will talk to that. The one aspect, though, that I think is important to draw out is then what are we talking about in terms of days lost? And Stuart mentioned in terms of this figure of 53 days. So when we looked at the survey results, 7.6 days of that was to do with people not turning up to work. That's the easy one. And 46 days was to do with presenteeism. And very much the survey is designed around creating a tangible measure for you so that you're able to understand over the course of a year what the impact is as it's driving this. I think one of the key things that, as we move through some of these results, is that the average age of respondents for the survey in Sri Lanka was 32. Across the region, it was 35, 36, up to 39 in some of our markets. So actually, we had the youngest cohort of respondents in the Sri Lanka Healthiest Workplace Survey. And that may start to play as a bit of a theme as we go through some of the results, how affected the younger profile of some of your workforce is being impacted with their health and well-being. When we talk about sleep, 7 hours is the international figure we like to demonstrate as being the ideal. Obviously, it's no right or wrong, but 7 hours is a bit of a benchmark as to what's the right level for on average. Sri Lanka performs pretty much in line with most of the market. Most people, close to half the workforce, aren't getting enough sleep, which is a big piece around awareness, education, and as mentioned in some of the video clips with David Beckham, the use of technology late into the night, a key driver in terms of people not getting enough of the sleep that they require to be effective in the workplace the following day. When we actually then looked at the results, though, around some of the stress aspects that came through the markets, two significant call-outs for Sri Lanka. The first, financial concerns. Sri Lanka had the highest score across all our markets at 31.5% of the workforce, saying they had a lot of financial concern. Again, this may play a little bit to the fact that it was a younger cohort here in Sri Lanka, but it is something to be aware of that that was 2 to 3 times the level of financial concern that we were seeing across our other markets. The other piece, again, to call out is stress beyond financial concerns. Again, 59.4%, the highest score across our region for people feeling that they were stressed in the workplace. Disturbingly, but this isn't just Sri Lanka, this is all our markets, symptoms of fatigue and stress in the workplace, symptoms of mental illness such as symptoms of depression are highest in the youngest employees. So when you step back and you look at, we've got a burgeoning workforce coming through, which obviously will be our managers and senior managers of the next 5 to 10, 15 years, already exhibiting significant signs of stress, significant signs of mental illness symptoms. This is a concerning feature for all of us. And as we think about how employment and the role of employment is starting to change with Generation X, Generation Y, millennials, it really does start to realize that both from a leadership perspective, but also people management, how we need to be thinking about onboarding and engaging with younger employees, and a very different way than has been done over the last 10, 15 years in the workplace. Another call out, and not again top of the leaderboard, which not a leaderboard you want to be at the top of, bullying in the workplace. By bullying we mean some form of mistreatment, whether it be verbal, by email, face-to-face. It can be from a line manager, it can be from a colleague. But again, Sri Lanka appeared to be the highest level of bullying by a substantial way across the region. And that very much then is a cultural aspect. Again, that may be impacted by a younger levels of respondent to the survey, but a key area to be aware of. Linking through to a culture of people feeling that they have control, and one of those pieces around people feeling comfortable to take breaks. Actually, Sri Lanka performs pretty well compared to a number of other markets. So people feel comfortable enough that they can take a break, which is a key indicator that people have a level of control in their daily work. Broadening the concept of control is people feeling they have a choice around what they can do within their work. And again, Sri Lanka and employees that responded actually performed pretty well in this theme of control. But again, another call out, the highest reading we saw, again, by a significant margin, over 30% of respondents said they were strained in their relationships at work. So again, high levels of bullying, high levels of stress, whether it be financial or otherwise, and then these leading indicators of people feeling that their relationships that they rely upon for support in the workplace are strained, all giving us indicators that whilst it may not be a big problem in terms of the levels of productivity, which we were seeing that Sri Lanka was actually quite low compared to some of our other markets, actually this could get worse quite quickly. So not to be too relaxed around the productivity points, because we're seeing a levels of stress and strain that may have significant impacts in the coming years across all your workforces. We always look at musculoskeletal, and then that's neck pain, back pain, knee and hip pain, and that's usually globally the key reason for absenteeism, so people not turning up to work. Interestingly, again, Sri Lanka probably one of our best performing markets for this, and again, probably because you had a younger level of respondents, less likely to be suffering from knee pain and back pain, which tends to come on with age. When we then move away from some of the symptoms that the survey demonstrates, we then move on to what we call vitality age. Now, in technical terms, that's mortality risk adjusted age. What it means in practical levels is if I'm age 40 and my vitality age is 45, it means I'm making lifestyle decisions around smoking, drinking, exercise, and what I eat, which is taking off 5 years of my life expectation. And so very much around when you look at your individual vitality age, which all of your employees achieved when they did the survey, and when we look at it on average, it gives you an indicator year on year that as you start to make improvements in your lifestyle decisions, you start to see your vitality age come closer to your actual age. So when we did that for Sri Lanka, the level was pretty much in line with our other markets. 4.7 years was the average vitality age of the 2,500 people who filled out the survey. So that means people are making lifestyle decisions which are taking off 4 years of their life expectation. Now, the one thing I would call out, you had a younger age profile who participated in the survey. So in actual fact, younger people already having 4 years of their life potentially taken away because of lifestyle features, again, plays to this theme that we're going to be facing significant issues in the market and in the health and well-being of our employees as we move forwards. Physical activity, and Stuart mentioned in the intro, a third of people not doing enough activity, which is leading towards some of that vitality age gap. But it's pretty much in line with the rest of the region. We all need to be doing a lot more physical activity in our daily lives. Nutrition, drinking and smoking, always a mixed bag across our markets. Again, Stuart mentioned 90% at risk from their nutrition, and that's a clear feature that needs to be focused on in Sri Lanka. Alcohol, you're actually our high-performing market, so you have the least issue with alcohol overconsumption. You can see from some of those figures the differences between Australia and the UK and Asia is quite significant there. And then smoking, it's in line with the market. It's still not great, 9.7%. So looking for improvement around smoking cessation campaigns to bring that down. Obesity, you are one of our high-performing markets in terms of low levels of obesity, but 13% overweight. This is only going to get worse over the coming years as the wealth in Sri Lanka continues to increase, as lifestyles become more sedentary. Obesity, which is already an epidemic in most nations across Asia, will only get worse here in Sri Lanka. So again, an area to be focused on and aware of. Blood pressure and cholesterol, actually, again, a younger profile, so not too bad. But again, and the older employees will be an area that needs continued observation. I'm not going to dwell on, this is just slide, lots of numbers, but this is all in your organizational reports as to the levels of detail. But really, what it calls out is there's a number of features whereby employers in Sri Lanka, you're doing a lot around health screening, digital health offers, but there are areas where we need to improve, and particularly around awareness. Sri Lanka was the lowest in terms of employees being aware of what their employers are doing. So only 9% of employees understood what their employers, so you people leading in the room, are actually providing for them. So again, this comes out to our call out really around, unless you create that awareness, you won't get the engagement in the activities that you're already providing to your staff. Positives, though, when employees in Sri Lanka are made aware of the services that you offer, they actually engage at a really high level. Close to 60%, once they understand that there are services available, will engage in at least one of the services that you offer them. So again, get people over that awareness hump, and they will then take the services that you're currently funding. So we've touched on a number of areas through the course of the survey, and as I say, do take the time to look at your organizational report because it does go into a level of detail. But very much, this is now the call to action. What can we actually do about these themes that we've demonstrated through this afternoon? The awareness, I'm not going to stress that enough through some of the case studies we'll look at, but also line manager training and understanding, are you doing enough around your line managers as change agents in your organization, whether it be to address levels of mental health, exercise, nutrition, or bullying in the workplace. Line manager training is a key area to be focused on. When you step back and if you look at organizations that do this most effectively, it's senior leadership. It's your board of directors, it's your chief executive, it's your senior management believing in the health and well-being of your workforces that actually drive the most consistent and persistent change and impact for organizations. So just to finish off in terms of looking at, so what do we do from here? A lot of information, a lot of trends, some of them quite scary in terms of the impact for both at a market level but also in your own businesses. This is a bank in the UK that started doing the Healthiest Workplace survey 4 or 5 years ago and looked at their report and looked at all the different aspects and really decided to go for a holistic program. As you can see there, physical activity, nutrition, through to mental and musculoskeletal health, cancer risk, etc., and really thought about education, awareness, how they engaged their workforces, and then creating interventions that related to these areas. This is not about having to do this to be impactful, but the one piece I would call out, as you can see in the graph in the bottom left, is that then they used the Healthiest Workplace survey year on year to then measure the impact. They took the report, they looked for things that they could do differently, put them in place, and then measured by taking the survey the following year to see where they were making improvements, and then did that the following year and the following year. And the key point really just to draw out with this type of case study is that health and well-being of your employees is not a single year activity. It's a multi-year program. Having that senior leadership commitment to see this through and then be able to demonstrate the impact that you're having through either a survey or taking other measurements is an important cycle to get into. The second case study I just wanted to talk briefly to, and this is an IT company in the US. They chose to really go deep on mental health in the workplace. Looked at the fundamentals around HR policy, making sure that people took their annual leave, flexible working, etc. So very basic HR principles. Organizational level initiatives, again, line manager training be a key one here. And the concept of mental first aid. So first aid, everybody aware of, you see a cut, you put a bandage on it. Mental first aid is the equivalent. Teaching people, line managers, staff in the workforce to recognize the symptoms of stress and the symptoms of your colleagues not coping and understanding what to do in that first response. Asking a question, taking them aside, having a conversation. This isn't about curing people. This is about recognizing those initial warning signs and making sure that people feel that they have a level of support in the workplace. That's seeing increased demand for these types of programs globally with recognized impact. And then you move through to education and awareness and tools being made available, which get, and with technology becoming increasingly complex and interesting. And then finally, in terms of a program of activity that you can think about, if you look at this, and this is work that we're doing in Hong Kong, is look at the survey, use that as your fact base to understand the risk profile of your business. As you can see in that slide, you can do other things, on-site blood tests to look at other disease levels, you can look at risk assessment tools, but just use the survey as your fact base. And then form a well-being committee. Make sure you've got well-being champions in every department across your business that take ownership of this, and then work out an annual calendar of things you will do. If you think awareness is going to be your biggest issue in the first year, make sure that you have wellness champions in each department that pick up themes, whether it be nutrition, whether it be exercise, whether it be stress in the workplace, and start to raise awareness. Get to the end of an annual cycle, and then take a measurement again. And as I said in the first case study, with the 2019 Healthiest Workplace Survey, you'll have a classic example to be able to take a survey instrument again and see if you've made a practical impact with your employees in 2019. This doesn't have to be expensive. This doesn't have to be using a lot of technology. Those things can help. But actually just having a planned activity that you own with your workforce is the first steps here to seeing positive momentum. So as I said, we have a panel later on if you have specific questions through some of the content that you can raise with us. But really just to finish with AIA, we're on a journey each year on year, ensuring that we're putting this Healthiest Workplace Survey in place and measuring change and raising issues as we do every year. Really a call out as you move into 2019 to hopefully seeing you all participate through the 2019 cycle. Thank you very much.